actually have more to say about trauma-informed treatment. First, it seems like there's multiple settings, schools, doctors' offices, hospitals that identify themselves as trauma-informed. And I literally don't understand where they're getting the idea that they're trauma-informed from, because it is so much work to be authentically trauma-informed. And I'm most interested in how a therapist can be trauma-informed. And the reasons why I'm most interested in that, like I've said, is that the therapy itself can become a source of trauma, and we have to do everything we can to avoid that outcome. So some other things that a therapist can do to create a trauma-informed environment is, if you're in person, have you ever sat on the couch and seen how it felt? Have you asked your client how they're feeling physically? Have you asked your client if there's anything in the office that is inherently triggering to them? If you're in telehealth, can you ask the client if there's anything in the setting around them that, is going to make them feel safe or calm? Before you ask dysregulating questions, do you know ways to soothe the client? Does the client have ways of soothing themselves? Do you know what you're getting into? We have to ask ourselves these questions when we expose our clients to traumatic material. How are we going to keep them safe? How are we going to keep ourselves safe? And how are we going to know enough about them in advance of these questions, in advance of the sort of excavation that trauma work requires, to be doing it in a way that's trauma-informed? And trauma-informed means a way in which we refuse to recreate the trauma.